Yes, thank you, everybody. Thank you, everybody, for sticking with us throughout the day. We have just had some fantastic panels, you know, opening it up with the future of healthcare financing with Mandy Cohen and Tim Ferriss, and really kind of laying out that big vision. And I think also showing us that COVID showed us that it's possible, right? That we can find a way to work together and be creative in our financing and really prioritize health. And how do we take that and translate that into some ongoing work? Our second panel, moderated by my fam, really, speaking with Don Alley and Lynn Nichols and Ben Kligler, and really thinking about how do we start taking this to the next level? How do we scale? And really pushing on where does that fund need to go, and kind of balancing the what that investment in health needs to be versus not over medicalizing, and really where that investment needs to be, so that we are not just continuing to promote a sick care system, but really promoting a system that that really incentivizes health. And then just an awesome panel to end on. And I want to come back to that statement that I think really wraps it up. No hope, no whole person health without population health, no population health without health equity, no health equity without addressing structural racism, and we can't address structural racism without including the community. So I want to thank so much to all of our panelists and moderators for joining us today. I'm going to give a little bit of a preview of coming attractions before I toss it to Michael to wrap us up for the day. So I hope that you will all join us back on the 28th. For our next session, it will start at 1 p.m. and we have another great slate of speakers and panelists. Our first panel will be elements of financing and payment models that effectively reward health and well-being. We'll have representatives from Health Management Associates, Care Solutions at Optum, and CityBlock. We'll have another innovation spotlight. Our second panel will be innovative federal and state models for financing whole person health and population health, with Donna Kinzer, Cindy Mann, and Aina Backus from Vermont. And then our final panel of that day will be innovative private models for financing whole person health, with David Fogel from Chi Healthcare, Cheryl Pegas from Walmart, and Dexter Sherney from Adventist Health. So we hope that you will come back and join us for day 2, and then again next week for day 3. And with that, I will toss it over to Michael.
Thank you very much, Keisha, and special thanks to both you and Mai, obviously, for your sterling work on behalf of the Planning Committee today, and thanks to each of our wonderful speakers. This was a high energy day in many ways, and I pick up that term in some ways from Tim. In his initial comments, he said that the requirement to be all in from his previous days at Partners was energizing to all on the staff. And we also heard a number of testaments to what energized people. And in fact, we just heard Nathan talk about the energy that he got from working in the community with high-risk pregnancies. And Len obviously focused us on the importance of paying smart. We heard Ben talk about the importance and energy that one gets from trying to design the system around the patient. That's a very provocative. I mean, it sort of rolls off our lips easily in some ways, but we ought to think seriously about how we design financing, design care, design data, so that the patient is in charge, and what that really means. We heard from Dawn about, in the same vein, about the issue of understanding what really is important to patients, how we match care with patient goals. So, and many more. I mean, it was just a spectacular day, a wonderful way to start. And so I'm energized myself. I'm going to spend some very enjoyable time looking back over notes and slides and getting ready for the next session. You've been a great warm-up act, I have to say. And I hope many of you will be able to come back on Friday where we started at 1 o'clock. But again, I want to thank all of the staff involved. Clearly, they've done a terrific job, all the planning committee, all the speakers, and all of you who tuned in. I hope you'll be back with us on Friday. And meanwhile, thanks very much. Enjoy, stay safe, and be well. Take care.